to arrange a time to come and share the details of that with you.
I would be happy to hear that, but what I think the American public needs to know is, are you really serious about that? Still giving out bonuses, still hearing these reports, and 130 complaints still continue to be investigated. I yield back, Mr. Chairman.
I hear you, sir.
Dr. Tuxford, the VA has come and briefed our staff and said that the VA believes that they have up to 1 year to be able to claw a bonus back. And is it your testimony that even though fraud was committed, that a bonus is still something that an individual should receive based on the information that was known at the time?
So I think you're getting out of my swim lane. I don't know the technical answer to that question, but I am happy to go back and get that answer for you.
It's called fraud, and that's illegal.
I understand.
Mr. O'Rourke, you're recognized for 5 minutes.
Thank you. I want to continue Mr. Huelscamp's line of questioning about Montgomery and just highlight some of what Ms. Lerner included in her testimony, that in 2012, a whistleblower who was a surgeon was first alerted to this misconduct by an anesthesiologist during a veteran's preoperative evaluation prior to an operation. So I think that establishes the danger and the threat and the potentially bad outcome for the veteran when we don't have the right information for the anesthesiologist in this case. Whistleblower reports these concerns to the Alabama VA management in 2012. They put him on this, or him or her, this FPPE evaluation, and during that evaluation, he does this again. He cuts and pastes information onto veterans' medical records, and then you get OMI involved, and then far worse than previously believed, the review determines that the pulmonologist engaged in copying and pasting, as Mr. Huelskamp and others have said, in 1,241 separate patient records. So a couple of things. You keep saying you can't comment on this. I mean, it just defies common sense and what all of us would expect from anyone, that you would just say that this person will be fired. I don't know why Ms. Lerner can tell us all these details, and this is now public record, and you can't tell us, and you can't tell the people in Alabama, more importantly, the veterans there, what's happening. And also, if we're talking about creating a culture of accountability, what does it say to the surgeon who is a whistleblower? What does it say to the anesthesiologist that this pulmonologist is still working? What does it say to the people who testified in the panel before yours about what happens when you have the courage and take the risk to stand up and alert your superiors to malpractice or malfeasance within a VA? I think the signal you sent to everybody tonight is, don't take that risk. We're not going to do anything. I mean, the sin could not be more glaring than that documented by Ms. Lerner here. Is there anything that you can say? What would it cost you or the VA or the federal government to go out on a limb and say, we're going to fire that person? He or she should not be working for us.
Right. So as I said earlier, I mean, there are reasons why I feel I cannot go into details here, right? So there are still active investigations going on into a lot of these issues by the OIG. If I put enough details out there, somebody can make connections, right, back to individuals. And again, these are complicated issues. I
don't know how it's complicated. Let me ask this follow-up question for Ms. Lerner. In your testimony related to this case, you say OSC requested and has not yet received information from the VA to determine if the 1,241 instances of copying and pasting resulted in any adverse patient outcomes. When did OSC request that?
I'm sorry, I don't know the exact date.
More than a week?
Yeah.
More than a month?
I'm quite sure.
Okay.
And we'll do a
Dr. Tuxman, what's the response on, I mean, I still don't understand why you can't answer our previous questions about why this pulmonologist is still working, but certainly you could answer this question about responding to the request to understand how this has affected patient outcomes.
Yeah, so I don't know where that response is. I did not know that they had not received something, but I can go back and take care of that and find out where that is and why a response hasn't been received. I mean, I can say to you that I think that, it is our intention, I'm committed in the job that I am now acting in to try and address these issues.
I'm not convinced, and I apologize, but I'm for interrupting. I'm just not convinced that you're going to do it. And I don't know you, so you can't take this personally, but it's been reflected in testimony we've heard from almost every representative of the VA for almost as long as I've been here, which has not been a long time, but long enough to know that we have a major problem with accountability and performance. And I'm not convinced that we're going to be able to turn it around from what I've heard. I mean, everything was lined up beautifully by the previous panel about the kind of problems and for how long they've existed and what's needed to change this. And then we hear from the VA essentially a non-answer that basically sends the message to us and to every employee of the VA that you don't take this seriously. I mean, you can say you're appalled, you can say you're outraged, you can say you're deeply disappointed, but that's all been said before. What we need now is, this is what we have done, this is what we are currently doing, this is what we will do. And I haven't heard any of that tonight. And just really quickly, Mr. Chairman, Dr. Jesse, the previous head of the VHA, when we alerted him to these outrageous problems in El Paso with 36% of veterans seeking mental health appointments not being able to obtain one, huge gross discrepancies between what El Paso VHA was reporting and what we finally learned through the VHA audit was the truth. Dr. Jesse's response was, let's not get into assigning blame. In other words, let's not hold anybody accountable. Let there not be consequences. Let's not change anything we're doing. I just have to register that very deep, profound disappointment that I have, and you've heard from so many others today. And I, through you, ask the acting secretary to change the culture now and change the responses that we're getting at these hearings.
Message heard.
Thank you.
Mr. Kaufman, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Dr. Tuchsmith, based on the testimony provided by the 4 whistleblowers here tonight, it appears that the same unethical tactics are occurring at numerous VA medical centers across the country. This would seem to indicate that there is a universal policy in place against whistleblowers that is well known among all the VA SES level supervisors throughout the country. Do you have an explanation for this?
Well, I don't believe there's any policy or a collusion to suppress whistleblowers amongst the top leadership of the organization. In fact, I think the organization has said today, particularly Secretary Gibson, that we intend to do something about that. The message has clearly gone out to everybody in that June 13th letter that there are consequences for retaliation. We have to go through a process when those complaints come in. I think of investigating those so that we treat people fairly and we know both sides of the story and we have the facts before we take action. But I think the organization, the secretary speaks for the organization, and I think that commitment is there, and I have to take him at his word. It is clear to me tonight from all of the comments here and from the comments from all of you, we have an enormous problem. And we are a huge organization. It isn't going to change overnight. I know we're all impatient, but it's going to take some time, I think, to fix some of these fundamental issues. It's going to start with really leadership, and we have a new acting undersecretary. We have a nominee. We will have a new undersecretary for health at some point, and I hope a new principal deputy undersecretary. And I think that the organization, that's the kind of change we need in the organization to get back on the right track. And it's
But how long have you been a part of? You've been a part of leadership in the VA for quite some time. How long have you been a part of the leadership?
For over 20 years, I've been
over 20 years, and you testified tonight that this is really the first time that you become aware of the problems that were brought forward by the whistleblowers tonight. Isn't that correct? That was your previous testimony.
I learned about these whistleblowers mostly by reading them in the paper, yes.
And so you've been in 20 years. Here's the problem. you've been in leadership within the VA,
Yes.
and you've been in leadership for 20 years, and you're just totally oblivious to what is occurring around you in terms of all the problems. And it really wasn't until that it's become a national story that now you're suddenly aware of them. And I think that really speaks to the culture of the VA and the problem, and that if not for the whistleblowers who have come forward, we would never be aware of the magnitude of the problems that exist today, because the leadership, or the lack thereof, never brought these issues forward. And I got to tell you, and let me ask you, are you a veteran yourself?
No, I'm not.
Well, I got to tell you, the military axiom for this is, I don't think you can lead starving troops to a chow hall. And I got to tell you that if the new secretary, when he comes aboard, after being confirmed by the United States Senate, which I believe he will, has folks like you in senior leadership, he is sending a message to us, the American people and the veterans of this country, that he is not serious about change. With that, Mr. Chairman, I yield back.
Ms. Titus, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to go back to what I mentioned earlier, and that's my concern about the emergency room doctors at the new Las Vegas hospital. They came and spoke with me at my invitation. They talked about the problems there, the lack of leadership, the manipulation of schedules, those who work for the VA directly versus those who are contracted from the private sector who get special treatment. And I just don't want them to get in trouble because of my initiating an invitation to learn more about what was going on out there. So I would ask you, if maybe you can't provide it here, but if you can let me know if they are among those cases that you have that have been filed, if anything has come out of Las Vegas.
I can't speak to any of the specifics. I can tell you we have not received any complaints from the Las Vegas facility.
Okay, well, I'm glad to hear that. I would also like to ask you, we heard, I think Mr. Davis was saying that there are different things are comfortable for different people. Some whistleblowers go to the press, some hire lawyers, some go to veterans advocacy groups, and some go to their members of Congress. Well, I think a lot of them come to me. This is our biggest constituent kind of service that we do in the district, was with veterans. So if someone who works at the hospital, some doctor or somebody who works out there, feels like they want to be a whistleblower and they come to me, tell me what practical advice I give them. Here's what you should do. Here's how you're protected. Here's who you call. Here's the form you fill out. What advice do I give them?
The first advice I would give is to please refer them to us. This is the number one priority in our office right now. We are throwing everything we have at it. We've dedicated over half of our program staff to dealing with these whistleblower retaliation complaints. And so that would be the first step. And once we get in contact with them, we can find out what their issues are. If for some reason we're unable to help, we can point them in the right direction.
And that would be, they would come to you here in Washington, not in Nevada.
Correct, in Washington.
Okay. All right, thank you, Mr. Chairman. I yield back.
Mr. Jolly, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I'll be brief. I would just like to know, Dr. Tuckschmidt, for the record, the stop the lying conversation that we had, because I do think it's important. You recognize the program. You mentioned the program. It was presented to me at my local hospital as something that was the end-all be-all for accountability and the ability of employees to step up and make a comment. And yet we had 4 whistleblowers, clearly with the conviction and courage to come forward, who hadn't heard of the program. And there's not really a question other than just, I recognize the importance of the program, but clearly it hasn't penetrated to the level that at least was presented to me during my meeting. And I would just finish tonight actually with a bit of a softball question, I'll admit it.
I appreciate it.
But it's an important question, and I'm going to give you the rest of the time to answer it. You've apologized tonight. You've spoken of accountability. You've mentioned being appalled, speechless. You passed your cell phone number. Mr. Makovsky impressed me several weeks ago by apologizing and referring to what he called a crisis of integrity. I noticed, as a new member of Congress, we have heard a change in tone under the acting secretary. And I will say, but for the witness who 2 weeks ago said the system was dishonest, which frankly I think was a deferral of responsibility. But by and large, I think we've seen a change in tone. You've been with the VA more than 20 years, is it?
Yes.
Here's the softball for you, but also exceedingly important. Have you noticed a change in the past 6 or 8 weeks as a result of the attention? How we got here is another question. Do you believe with 20 years plus experience with the VA that we are entering a new era of leadership within the VA, regardless of who steps into the position? And the time is yours on that one.
I do. So I think that there are many places around this system that are phenomenal, where we have outstanding care, better care than exists in private sector. We have places that have outstanding access. Our problem, I think, one, I agree with you absolutely, we have a crisis of integrity. How we restore that is going to be a slow and painful process. The clinical issues, I think our biggest issue is that we do not have a uniform, systematic approach to these things. And so we have pockets of excellence and places that are not performing so well. The amount of activity in the 4 weeks that I've been in this job and have had the opportunity to be aware of these problems has been outstanding. I mean, the secretaries out there, we are sending hot teams into the facilities. I think we've sent teams into Phoenix now 3 or 4 times to help them, to ask them what do they need, and I spend my days trying to get them what they need. I can tell you that 12 of those 20-something years, I was a facility director. I practiced as a clinician in the intensive care unit. I'm a critical care physician. I practiced there. I knew what was going on in my facility. I walked the halls. My values I wore on my shirt sleeve. And people knew where I stood on issues around integrity, around bringing problems forward, about people coming together and solving those problems. There was no doubt in my mind about what it took to make sure that the patient was the end-all and be-all of what we took care of. That's why we were all there, every one of us. And if you weren't there for that purpose, then you better take a hike. That was clear, I think, to everybody. And I don't know that I'm the perfect shining example because, quite frankly, I spend many nights sitting in bed wondering what I could have done differently, what I personally could have done differently. When could I have raised my hand? Could I have pushed back harder? What did I not know that I should have known? Many sleepless nights. I don't know that I am the epitome of what it's going to take, but I think it's going to take leadership who really, not just at the secretary level, not just at the undersecretary level, but all the way down to the service chief, who owns the problem and says we can fix it. And I think we have a lot of great people in this organization that will step up to the plate, and I'm confident that we're going to bring new people into the organization today to help solve those problems.
Thank you very much. Mr. Chairman, I yield back.
Thank you, Mr. Jolly. Thanks to the panel. Based on our hearing today, we would expect the Secretary of Veterans Affairs to establish a long-term plan of intended actions with target dates that would determine what actions to take against VA managers when reprisals have been found to have taken place, notifying on a periodic basis all employees of their whistleblower rights, and measuring the effectiveness of such actions, such as a periodic survey of employees, and designing and implementing a system for tracking overall whistleblower complaints for which reprisal was determined or the complaint was settled. In addition, we recommend that VA analyze this data periodically to ascertain whether additional steps are needed to ensure that reprisal is not tolerated. With that, I ask unanimous consent that all members would have 5 legislative days to revise and extend their remarks and include any extraneous materials. Without objection, so ordered. I want to thank both panels of witnesses and the audience members for joining us at tonight's critical hearing on the importance of whistleblowers and effective oversight investigations. And Dr. Tuxmick, one last question: Is Ms. Hellman still on the payroll?
I don't honestly know the answer to that question.
Does she work under your purview?
Many layers down.
But you don't know if she still is on the payroll?
I would have to get an answer and take that for the record.
Okay. With that, this hearing's adjourned.
This was the fourth nighttime oversight hearing so far this summer for the House Veterans Affairs Committee. It's an unusual practice that staffers are hinting could become the norm. The Navy Times writes that committee staffers say they're already planning more late hearings in advance of the August congressional recess. We've been asking for your comments about the hearing at facebook.com/cspan. Kenneth writes, as a U.S. Army veteran, I am not happy at all with all the recent stories about the VA. Finger pointing and negative remarks are not going to fix this mess. Chuck says, about time somebody stands up to the federal government and its corruption. A comment from Paula, thank these people for all their courage and willingness to put themselves at risk by telling the truth. And the last one from Jim, just one more example of the bureaucracy of the government. So many levels of management and no one does anything. President Obama is requesting a nearly $4 billion in emergency funding from Congress to address the influx of unaccompanied children coming across the U.S. border.